Hey guys, it's Sarah here, and today I do not have an ASMR video for you. This is actually a video about my gallbladder removal surgery. So I got my gallbladder removed actually exactly a week ago. And I know that videos like this, watching people's stories about their gallbladder removal, like looking at their symptoms, and seeing why they made their decision to get it removed, that really helped me in coming to my decision. And so I wanted to make a video for anybody out there who may be having symptoms but don't know if it's their gallbladder, so they can compare their symptoms to mine, see if that's helpful. Also kind of just talk about the process and see if it sounds worth it to you. And I'll go ahead and tell you that I would definitely get it done again if I had to. Yeah, so I'm gonna go over all my symptoms that I had leading up to the surgery experience itself, and then I'll go over my recovery process in general. So I'll go ahead and start with all my symptoms. So I was actually, it was last July, I was on vacation out of the country, and a couple of days into the vacation I had eaten dinner, and I noticed I started getting this weird, like, contracting, like squeezing feeling inside my upper right abdomen, which is like where your liver and your gallbladder are. And it was the strangest feeling. It feels like a muscle kind of like twitching nonstop. And like it was just all of a sudden. And after that, every single time I ate anything, I would just get that weird contraction feeling. And it happened the entire time I was on vacation. It probably didn't help that I was eating like foods high in fat and I was drinking a lot of wine and stuff, so that probably, I'm guessing, like kind of kick-started it. But I got home from vacation, everything went away, I thought everything was fine, and then slowly but surely it started coming back. And then every time I would eat, I would get that weird contraction feeling, and it wasn't like painful or anything, but it stayed like that for months. And then I slowly started getting, okay, I'm going to be talking about bowel movements here. If you don't want to hear about poop and all that, just don't watch this video. But I just want to be clear and get all of my symptoms out there so you guys can know. So I was having like looser bowel movements, which is really not, that was really unusual for me. And I talked to my parents. It turns out actually everybody on my dad's side of the family has gotten their gallbladder removed. A lot of people have had gallstones. My dad, he didn't have gallstones, but he just had unknown inflammation in his gallbladder, which is what I ended up having too. But so it definitely seems like it's some sort of genetic thing that was going on, because everybody has had to have it out on his side of the family, and even somebody died from gallbladder cancer on his side of the family, and that is a very, very rare type of cancer. So that was pretty concerning. And so I got an ultrasound done on my abdomen in like October, I think, and I didn't have any gallstones, but I had gallbladder sludge, which is like basically a thickening of your bile. And that's like a precursor to gallstones, and most people who have sludge eventually do end up forming gallstones. Then I got a HIDA scan done, which is basically a scan where they check, so your gallbladder, it stores bile in it, and then after you eat food, it ejects and like squeezes and ejects bile into your intestines so that it can digest fat. And you need a certain level of function, I guess, for that to happen. So they were measuring the percentage of bile, I guess, that was ejecting from my gallbladder. And a normal amount is like greater than 35%. And I was actually at like 91%, which is crazy. And I didn't find out till later. I thought that was normal, but I found out later from my surgeon that that's actually abnormal. I think over 80% means you have an overactive gallbladder, and I tried to look into that, and there's not much about like hyperactive gallbladders, but I think that's what I actually had, because my dad had the same thing. He suffered from gallbladder pain for 10 years, and he had 3 different HIDA scans done in that time, and every time he was in the 90s too. So I think there's something abnormal going on, and I had the same thing, some sort of genetic component, I think. So after, like, in December, I think, everything just went away for like a whole month. I had no symptoms whatsoever, and I thought, great, like, it's gone, maybe it's gone forever. Disclaimer, it wasn't gone forever. And so about a month later, things start happening again. And that's also, also disclaimer, I'm not a medical professional, so don't take everything I say. Like, if I say something that's incorrect, just correct me, please. and you don't have to take all my advice, like I'm not an expert. So one thing that I learned from one of the doctors is that it's common for gallbladder symptoms with diseased gallbladder to just come and go, like whenever, with no rhyme or reason. So where was I? Oh yeah, so everything came back in like January. And this time I was having pain with it too. It wasn't just the contraction anymore. After I ate, I was getting like pain in that region. And I was also getting steatorrhea, which is basically like fatty stools. So you have undigested fat in your stools, and you can like Google that and check that out if you think you have that. But that is not fun at all. So I started trying to look into different diet changes, because a lot of people say that you do need your gallbladder, like you shouldn't have to have it removed, like all you need to do is change your diet. I don't believe that now. Like obviously some people have emergencies with their gallbladders infected and all that, and like I definitely think gallbladder removal is beneficial for a lot of people. But at the time I thought, maybe I'm just not trying hard enough. But at the same time, like I go to the gym 4 to 5 days a week to lift weights. I meal prep all my meals. Like I eat out on the weekends, but that's it. Like I'm a very healthy person, and so this shouldn't be happening to me. But I thought, maybe I'm just not trying hard enough. Maybe I need to be taking all these supplements and stuff. So like, I tried different things. I tried to cut out dairy. I tried to cut out gluten. Nothing helped. And so yeah, I was having these symptoms on and off up until March. And one additional thing is that stress. Like I would get these painful symptoms after I ate, but also if I got stressed out enough or anxious enough, that alone would set off my gallbladder. And I'm in a PhD program, so that has a lot of stress that comes with it. So that kind of definitely made things a little more stressful, and especially at the beginning of March, that's where everything just went kind of downhill. So I had just finished up a very, very hard class that I was so stressed about. I also had a really stressful thing happen in my personal life that gave me a lot of anxiety. And after that event, like, everything just kind of got worse. So at that point, I was also, after I ate, I was not only getting the pain in my abdomen, I was getting really intense pain between my shoulder blades, which is apparently also a common symptom. It's called referred pain that you get from gallbladder stuff. And then it was also, I was getting headaches in the back of my head, which is weird because I've never been a person to get headaches. I've just never gotten them. So after I ate, I would get all these symptoms, and I would get really lightheaded too. I tried different things. I tried taking turmeric, I think it's called. There are these supplements. It's supposed to be anti-inflammatory and be helpful to your gallbladder. I was taking apple cider vinegar after I ate to try to help aid in the digestion of my food. What else? I was taking bile salt supplements because I thought maybe I'm not digesting enough fat. That's why I'm getting, fatty stools, and like maybe I just need bile supplements. That did not help at all either. And it just got to the point where I also tried an elimination diet. I was eating just chicken and rice for a while, and I tried to just add different fats in to my diet again to see if like I could eliminate certain things, and just no matter what, if I added anything back in, it just like immediately I'd start getting the symptoms again. It just felt like it wasn't diet. Like no matter what I did, like nothing helped. And so I was just having, everything kept getting worse and worse. I was just having diarrhea all the time, and it got to the point where my food wasn't even digesting. It was just like going through me. I was not absorbing anything, and I was too afraid to eat food with fat in it because of all the pain I was getting. I lost so much weight. So I think in October and November I weighed 130 pounds. I'm 5'8", and so I've always been naturally very skinny. I just have a fast metabolism. So I weighed 130 pounds. I currently weigh 114 pounds. I've lost over 10% of my body weight. And that's probably been the roughest part of all this, is just like losing all that weight. I had worked so hard to build so much muscle over the past year, going to the gym and focusing on my diet and everything, all while doing this PhD program. Like I put so much work into it, and then just to see all the weight fall off of me and just like kind of turning into skin and bones in a matter of a couple months. It was so hard. It was so difficult. on my mental health and just having people make comments about my weight. It was really hard on me. God, I don't want to cry. And it got to the point where I was too weak to go to the gym. I had no energy anymore. I wasn't keeping up with my lab stuff. It was affecting my work, and it was just really affecting my life physically and mentally. I also had to plan my days around if there'd be a bathroom around or not, because I had no control over when I had to go or not. So it just basically controlled my life, and I was absolutely miserable. And finally, I just called my parents one day, and I just said, I cannot live like this anymore. I just can't. And so we found a surgeon, and I got a referral the next day to see him, and then we had an appointment scheduled for 2 weeks after that. So overall, I asked other people for advice and stuff, and mostly I got support from most people. I had a couple people that tried to say, you need to be doing like this and this to change your diet. You don't need your gallbladder out, but like overall, I'm very glad that I made the decision that I did. So that's been a whirlwind. And do I have any other symptoms? I don't think so. If you have any other questions about my symptoms, you can ask me in the comments. And so now I'll talk about my whole surgical experience. So going into surgery, I was so nervous about the anesthesia. So nervous. I just don't like the idea of like any drugs that control my body in a way where I can't do anything. I was afraid I'd be able to feel myself blacking out and that I'd just be sitting there during surgery paralyzed. I know that's not how it works. Obviously, I've had my wisdom teeth out, but for some reason I was terrified. So I got to the hospital. They called me back, and when they put the IV, I was cool up until they put the IV in me, and then I realized, oh crap, this is real, and I just started bawling. I was crying, and the nurse had to comfort me, and different doctors were coming in and talking to me. They gave me 2 doses of this anxiety medicine, and after that I was good. I was feeling good. So after that, I was set to go, and they wheeled me into the room, and they put, an oxygen mask over me, and that's all I remember. All I remember is that going over me, and I was like, is this it? And they were like, yeah, it's starting. And then all of a sudden, my eyes were open, and I was in the recovery room, also crying my eyes out, because I don't know. I knew I'm a crybaby, and I know that anesthesia also makes people emotional. But my surgery was scheduled for 1:45 p.m. I was out of the hospital by, I think, 2:30, 2:45. It was so quick. I woke up. They made me go to the bathroom to make sure I could pee, because sometimes you can't urinate after anesthesia, but I was fine. And then they just wheeled me out to my car, and I was ready to go. And when I got home, I did have pain. I had, kind of a stabbing pain going on, in my abdomen, but I was on pain medication. It wasn't anything terrible, and I honestly felt a lot worse after waking up from my wisdom teeth surgery. So I got home, I chilled, ate some crackers, had some applesauce. I had a quesadilla, which I probably shouldn't have had, but I felt fine after that. And, basically I just kind of would walk around the house a little bit throughout the day, because they say you need to get things kind of moving. And since it's a laparoscopic procedure, they fill up your abdomen with carbon dioxide, so you still kind of have some left over in there, which can cause a lot of discomfort. And so walking around kind of helps get that out. And so I will go over all my pain symptoms now. From afterwards. I'm not trying to say all this stuff to scare anybody, but I'm just going to be real about all my pain and everything after surgery. And also, just so you know, I am a huge crybaby. I have a very low pain tolerance, so just keep that in mind. So if I can get through this, I think anybody can get through this, really. Sorry, I have notes here because I just don't want to forget anything. So yeah, the first day back, it was mainly just stabbing. It's kind of I never, the first day I couldn't lay down all the way, just because if I had to get up, I had to use my abdomen to do that, and so that was hard. But that night when I went to bed, I made the mistake of laying down on my back that night, and when I woke up, I woke up in the middle of the night and I just had excruciating pain in my abdomen. It just felt like all that trapped air, I think, had just settled there. And I couldn't move. I couldn't even move my head at all. I was just stuck there, and I had to call my mom, like, Mom, can you bring me medicine? And I took, after like half an hour, it kind of dissipated a little bit, but I would talk to your doctor about what the best sleeping position is for after surgery, because my surgeon didn't really talk to me about that, and I didn't know. And so I slept like that, and it really seemed like that wasn't the best for me. So every night after that, I kind of slept propped up on a pillow. But yeah, I would also like keep somebody. I made sure like someone was kind of around to take care of me for the first couple days, just because if I like laid down at all, I couldn't get back up by myself, because like it's hard using you can't use your abdomen really, just from the pain. At least in my case, like some people recover a lot quicker than I did, for sure. And so the second day, like after that morning pain subsided, I mostly just had, discomfort in my abdomen. I was able to go eat Mexican food that day, and I was fine. So I definitely tested myself a little bit too much the first couple days, but it was fine. Day 3, I didn't really have as much pain in my abdomen anymore, but I was just sore everywhere. My entire back was really sore. My throat was very sore, and my jaw, I couldn't open my jaw all the way. And I think that's because they put a breathing tube in you during the surgery. But I think, that's a normal thing. And what else? Yeah, my chest was sore. Just breathing in really deep was hard. It just felt like I'd gone through like the hardest workout ever and was like sore the next day. So yeah, just expect lots of soreness, kind of. What else? So then, also, I was around my siblings a lot, and they make me laugh like a ton that day. And so I ended up laughing a lot, and that is really hard. Like that really hurt, like my gallbladder area in general. And so I think I had some soreness just from that. Disclaimer, like sneezing, coughing, laughing, I would try to avoid all those things at all costs for the first couple days. Let's see, what else? Day 4, every day was a little different. I had different, pains every day, but it's gotten a lot better, obviously. So day 4, I kind of had just a lot of nausea, I think, because I still had gas, like, kind of trapped in my belly. I was constipated for the first 3 days, and that's really normal, just because you're not moving around a lot. The pain medicine can stop you up, and so it just felt like I had a lot of compression down there. And I'd also drinking milk that day, and I don't think my body is ready for milk yet. So I just like all day just had this bubbling thing going on down there. So that was a little uncomfortable. So I just be careful in like introducing foods back in that have like, high fats and stuff like that. Because I may have done that a little too quickly. But after that day, like my bowel movements went back to normal. And like they've been completely normal ever since, which is so huge for me, because I hadn't had a normal working digestive system in months, and now that's just all gone, and I'm so thankful for that. So day 5, I was feeling really good that day. I was a little too confident. I decided I was gonna go shopping. That was a big mistake. Don't push yourself if you too soon, if you feel like you might still have a little bit of pain, because I went to the mall and I was so out of breath, and my back all over just was hurting really bad. I think part of it is that I was sleeping propped up and my body wasn't used to it, so I just had a really sore back because of all that. And my abdomen was hurting a lot just from like all the exercise and walking around, so that kind of set me back a little bit for the next couple days. But the next day, really all I was experiencing was just if I stood up for too long, I would have really bad back pain. It was like a spasming pain too. So I'd just be careful with that. Like definitely like walk around your house, like you want to like get moving and stuff, but don't push it too hard. I think I pushed it a little hard. But after so that was day 6. Day 7, which was yesterday, and today, day 8, my back pain is mostly gone, which is great. Most of my symptoms are gone. The only thing I'm still struggling with, I'm having a lot of nausea, like when I wake up, also when I eat. That's been really difficult because I'm trying to put on weight again, but it's hard when I can't eat really well. But I just got some anti-nausea medicine, so that should make things better. I've heard it's kind of normal to have nausea for the first week or two. And I think I've been kind of like introducing like more calorie dense foods into my diet, probably a little too soon just because I've been so adamant about trying to put the weight back on. And so maybe I need to be more patient and like take a step back, be more gentle on my digestive system. But yeah, so today I feel this is the first day that I felt like overall just a lot better, and most of my symptoms are gone. I haven't been back to school and lab yet. I took a week off. So I definitely suggest like taking a week off for yourself, at least after the surgery. I'm probably going to go back to grad school Monday. But yeah, overall, yeah, I just wanted to give you an idea of like what kind of pain and symptoms you could expect afterwards. To me, like, it was definitely, none of it was so bad that I felt like I need to go to the hospital or anything. It was uncomfortable, but like if you go into it prepared and you know you're going to experience pain, like that's just what you have to deal with every kind of surgery. It'll be okay. Like, it's really, if I can get through it, I'm a crybaby. Like, I think anybody can get through it. And all of my symptoms pretty much are completely gone. The only thing I'm still dealing with is the nausea, and it's still only been a week. So overall, I'm so glad. I'm so glad I had this surgery, really. So yeah, I think that's about it. If you guys have any questions about anything at all, or you want to pass on this video to someone you think it would help, I would greatly appreciate it. I'll probably make a follow-up video in like a month or two, just going over my symptoms at that point and like what I can and cannot eat by that point. I'm still trying to figure that out, obviously. So yeah, thank you so much for watching. I really appreciate it.